The Housing Matters Action Group has been working on affordable housing solutions with the community in Bellingen and the Bellingen Shire since 2017. And increasingly, we've become more and more concerned about key workers and local workers being priced out. We've started an initiative called the Waterfall Way Community Land Trust, which is about long-term, forever affordable, permanent, secure homes for local workers, including essential workers. But that's going to take time, and we realised, along with the Bellinger Health Action Group, that we needed to act now as a community. So we're really pleased to be working with the Bellinger Health Action Group and Bellingen Shire Council to do what we can to activate the community now to respond to this crisis with the attraction and retention of nurses and other health workers in our area. We know that this is a problem right through rural New South Wales. It's not just us, but we know that we can't wait for government to fix it, and that as a community, if we want to keep our hospital services and our health services, we need to act and we need to find a way to crack this problem.
Well, I got involved in the Health Action Group after the closure event, and one of the things that we identified as an issue with retaining and recruiting nurses in this district was the lack of housing. So we looked at a few of the different reasons why we've been unable to retain the staff up here. And we're hearing that a lot of nurses are going to other locations where there is more affordable housing. New South Wales pays around 20% less than Queensland, plus housing affordability here is a big issue for the nurses and doctors and teachers working in this area. So we decided that we needed to start addressing those housing issues that we're hearing are so important to the people in this district.
A nurse contacted me yesterday at Bellingen Hospital, currently living at Coffs Harbour, and it's just very hard for her to commute back and forth. So to find something affordable for people like that is extremely difficult. So there's nothing for that middle section of people. There's very, very little out there. Every applicant for a rental property, it states the percentage of their income that is going towards rent. Now I know that it should be no more than around 30%. That's hard. But I'm getting these applications where it's 60%, 70% of their total income, and I think, well, they're going without meals.
The problem is that there's just a really big gap now between house prices and wages, and that really kicked in during COVID and it hasn't got any better. House prices might have dropped a bit, but the gap with local wages is still so big that it's just really unaffordable. So when we looked at the stats, we were really gobsmacked when we found that if you were a first-year registered nurse and you were working at Bellingen Hospital and you wanted to try and buy a house in Bellingen, looking at the median house prices, you'd be paying 108% of your wage in mortgage. We just couldn't believe it. I mean, that says it all, really.
I think what we're already seeing is a hospital is more than just a building. It needs nurses to make it operate. And if we can't keep the nurses that we've already got, or people don't want to move up here, we're facing a real risk to our hospitals.
It is a real concern for the community that we've had an extended period now where there's a significant number of beds that have remained closed because the nursing positions can't be filled. I know at Dorrigo there's even a subsidy made available for housing for nurses, and still we can't attract people to those roles. So that's a big issue, and it's very concerning. But I think from the housing point of view, it's definitely come up as one of the main reasons that they can't attract and retain staff.
The community is growing faster and faster every day, and more people need the hospital, so they'll have to go to Coffs or Maxwell, and that's just such a trek. And you wait, I don't know, 7-8 hours or more in Coffs Harbour Hospital just to get in. Mm-hmm. So it'll be a devastating effect for the area, really.
So we really would ask that all of the community members right across the Bellingen Shire get involved with this initiative. if you can have a think about if you've got a spare room, if you've got a converted garage or a spare self-contained living space that you could rent for an affordable rent, if you could host a student placement, you know, maybe you've got an Airbnb and you could make that available between the school holidays at an affordable rent for a health worker on rotation. Or maybe you've got a couple of Airbnbs and you might be able to flip one as long-term affordable rental. You know, if everyone just has a think about the resources that they have at their disposal and think about getting involved, that will make a big difference. And even if you don't have anything like that you could contribute, please tell your friends and please support this campaign, because Homes for Health is about the community and keeping our health services going in this wonderful place that we're all blessed to live in, and we can do it.